Hello, my name is Lisa Vanover, and today I'm going to be speaking to you about Jamaica. And we're going to be talking about comparisons and contrasts between the United States and Jamaica. First, we're going to talk about the type of healthcare systems between the two countries. As you can see, Jamaica has universal healthcare, which is ran by the government, which means everybody has healthcare. The only issues with this are government hospitals and government-run clinics there's very long waits. They have low resources and often poor facilities. You can buy private insurance in Jamaica, however it's very expensive, but you're going to get better care. In the United States, we have a private health care and government care for the public in certain populations, and that's Medicare, Medicaid. A majority of our health insurance, however, is from employment, which just means we get our insurance from our employer. Let's move to population health between the two countries, and specifically the life expectancy from birth to death in Jamaica versus United States. As you can see from the total population, the mean is about 73 in Jamaica, males 72, females 75. If we move to United States, we can see the numbers are up from there. 78.6 for total population, males 76, females 81. And both, of course, the females have longer life expectancy. And per some science, they say it's because of our extra X chromosome. It seems to keep us healthier and live longer. And also, women seem to seek preventative care more than men. If we're going to move to healthcare spending. So the health expenditures total of GDP in Jamaica, the total percent of GDP in 2014 was 5.362. This percentage has declined since 2012. We move to the United States, however, the total percent of GDP in 2014 was 17.141. And this percentage, however, has remained stable since 2012. Moving on to healthcare systems, and specifically emergency department visits between the two. So the A&E casualty visits in Jamaica, as you can see, were 669,962. These are from 2016 numbers. And A&E/casualty in Jamaica is their accident and emergency department. That's what theirs is called. The reason why there's probably a big number discrepancy between the two, a couple reasons. Long waits, again, lack of resources. If you're sick, you know there's going to be a very long wait. You might not go to the ER. And we're going to switch to the United States. Our visits are very vast. 136.3 million visits. These are again from 2016. And I believe the reasonings are, one, we're very insured, so we'll go to the doctor when needed, but we also use the ER too much for simple things that we could see the primary care doctor for. So I feel like our ER is overused, which may be the reason for that high number. We're going to go to public and health prevention. We're going to talk specifically about youth marijuana usage between the ages of 12 to 17 between the two countries. So in Jamaica, these numbers are from 2014 to 2015 for both countries. About 21.56 have used marijuana in their lifetime. About 12% have used it in the past year, and about 7% have used it in the past month. Switching over to United States, I have a number of 1.8 million have used in the past month, and 7% are current users. The Jamaica numbers do come from a multi-centric drug research proposal. Speaking of physical environment, just going to switch things over one more time. We're going to talk about lead poisoning between the two countries, and children specifically. In Jamaica, about 42% in the rural areas and 71% in the urban areas have lead levels that are above normal. That's just terrible. The studies reported that the mean levels of lead in their soil are 4 times that of the other parts of the world. And this could be because a little bit of Jamaica still has leaded gasoline. They also have production lines of batteries and battery processing, which just lets lead into the soil and of course gets into mainstream in our foods, etc., which can cause the numbers to go up. These numbers have dropped a significant amount in the last 2 decades. However, they're still too high. Now, switching to the United States, about 1.2 million children in the United States have lead poisoning. These numbers are increasing secondary to there not being testing anymore. And then if you don't test these kiddos and they have lead poisoning, they don't get treated. The United States started the testing in 1995, but for some reason, a lot of kids now aren't even being tested for lead poisoning. Talking about access to care, and specifically unable to see the doctor due to cost in these 2 countries. Now, as we learned before, cost is not an issue in Jamaica, so there's not going to be a cost issue with seeing the doctor. It's going to be, again, long wait times, lack of resources, and poor facilities. Again, if you choose to pay for their private insurance, it's very expensive, but from what I've read, you're going to get amazing, efficient care. Now, switching to percentages in the United States, which are from 2016, about 13% of the population were unable to see a doctor due to cost. Lots of reasons for this, being a high cost of insurance, lack of insurance, being underinsured, or no transportation to care. You could have insurance but no transport to get there, so you're not going to go. Talking about social and economic environment, specifically homicide rates, so crime, but homicide, focusing on homicide within the 2 countries. Per the Crime and Safety Report, about 36.1 per 100,000 homicides reported in Jamaica. These are from 2017. The U.S. numbers are from 2016. The rates for Jamaica here are in the top 5 in the world per capita. Possible reasons for this, like all crime, low economic growth, high unemployment rates, and debt burdens. United States had about 17,000 reported murders and non-negligent manslaughter cases reported in the U.S. Again, this is 2016. The highest rated state is Louisiana, 11.8 per 100,000. We're still seeing higher rates than internationally, but these rates have declined in the past years, which is a good thing. So we're going to summarize and takeaways from this presentation. Obviously, there are gaps when comparing and contrasting healthcare in the U.S. versus Jamaica. The main differences is the healthcare. They have the universal care. We do not. Universal care is obviously not working. Ours is not perfect, but it's better and it's more efficient overall. The poor healthcare, high rates of lead exposure, increased crime rates, these are key issues that Jamaica needs to remedy in the future. Jamaica is a beautiful island, but there is much potential for the growth and improvement in many aspects, including social, economic, and health, that just need to be remedied for the country. Thank you very much. My resources are as followed, and I appreciate your time. Thank you.